Today we're going to cover the respiratory system anatomical structures. So when we look here, we've got the nostrils, which are called the external nares. You've got this cavity right here. This whole cavity is called the nasal cavity. Inside that nasal cavity, you have these three structures. This is the superior nasal concha, middle nasal concha, and inferior nasal concha. Now, if we go to the posterior aspect of the nasal cavity here, and we follow it down, this structure is called the pharynx. Now, pharynx is not how I'm going to test it. It's going to be broken into sections if I test. Behind the nasal cavity, we have right here the nasopharynx. Going from here to here, behind the oral cavity, we've got the oropharynx. And this thing is called the larynx, and so behind that we have the laryngopharynx. And those are your three sections of that tube called the pharynx. If we go to that posterior aspect of the nasopharynx here, we've got this mass of tissue. This is called the adenoids, or the pharyngeal tonsils. If we look here, we have the tongue. And so we go to the posterior inferior aspect of the tongue, and this right here, this is your lingual tonsils. If we go here, this is the palatine tonsil. Okay, there's one on each side. When you say ah on either lateral posterior wall of the throat, this is how it looks on the actual model. Palatine tonsil is here. Sometimes it's orange, sometimes it's not on these models, so be careful with the colors. Now, if we go here, we have the hard palate. That's this bony portion here. Then we have the soft palate. Now, the extension of the soft palate, or the bottom of the soft palate here, is called the uvula. So if I'm here, we're hard palate. Here, we're soft palate. If I'm down towards the bottom piece, that is called the uvula. Okay? All right. Now, if we scan over to this guy, and we'll go back. If we look from this frontal view or coronal view, you've got the nasal septum. That's this right here. Okay, this is a nice view of the nasal septum. You can see the middle nasal concha here, these two guys, and the inferior nasal concha. You cannot see the superiors from this particular view. The last thing that I want to show on this one are the maxillary sinuses. Okay, so these are maxillary sinuses, and they're visible on this one and then our sinus model. So let's scan back over to this, finish up some sinuses. From this view, the sagittal view, we can see the frontal sinus, and we can see the sphenoid sinus. Now, this is a little septum in the sphenoid sinus, but this is all sphenoid sinus. So both of these are part of the sphenoid sinus, okay? Now, come down here, we'll look at this structure is called the larynx. I won't test that structure named the larynx, but the parts of it we need to know. So we've got this right here, this flap. This is called the epiglottis. Now, understand that this is, it's a section, so we cut this in half, so you're looking at half of the flap. What happens is this flap comes down and closes off this opening called the glottis that I would show on a picture, okay? And so this is the epiglottis right here, so all of this flap. And when we look inside the larynx, we've got vocal cords. This one on the top, this one on the bottom. The one on the top, these are the false vocal cords, also called vestibular folds. Bottom, we have the vocal fold, which is also called true vocal cords. So pick whichever name you like best, true vocal cords, false vocal cords, or you could say vocal fold, vestibular folds, okay? And so that takes care of this model. Okay. So this is the sinus model. We've got the four different paranasal sinuses. The yellow are your frontal sinuses. So if you look here, these yellow are frontal sinuses behind the frontal bone. If we go behind the maxillary bones, we have maxillary sinuses. If we go inside the sphenoid bone, this blue one, this is the sphenoid sinus. And these greens inside the ethmoid bone, these are ethmoid sinuses. Okay, so we see all of those. And those are the paranasal sinuses. You can see all four here. From the sagittal view, we can only see the frontal and the sphenoid. From that frontal view, we can only see the maxillary. So on that one, we can see all of them. Now this model, we're going to talk about some other structures. If we come up here at the top of the larynx where the hyoid is, we go down. You've got this cartilage here called the thyroid cartilage. And the point or the apex of the thyroid cartilage is called the laryngeal prominence. Okay, so if I'm pointing here, I want laryngeal prominence. Anywhere else on this cartilage, I'm thyroid cartilage. If I go down to this ring of cartilage, this is called the cricoid or cricoid cartilage. And then we go below that, and we've got the tracheal cartilage rings. okay? So this is basically the trachea, and these are the cartilage rings of the trachea. As we dive below these blood vessels, we still have tracheal cartilage rings until we get down to the last tracheal cartilage here. This is called the carina. From the carina, we branch into the primary bronchi. Now, this is important to make sure we're labeling left and right. So we go here. This is the left primary bronchus. Bronchus is singular, bronchi is plural. And then we're going to branch into secondaries. This is the left secondary bronchus. This is also a left secondary bronchus. Okay. And then the secondaries are going to branch into tertiaries. So we've got left tertiary, and left tertiary bronchus. If we go on the right side, we have right primary bronchus, right secondary, secondary. There's a secondary underneath these arteries here, this artery and vein that you can't see. And I know that because then it branches again into tertiary. So we have to be careful to make sure we're counting from the carina, primary, secondary, tertiary bronchus. Okay, primary, secondary, tertiary bronchus. Okay, that takes care of the bronchi. All right, the last thing I want to show are the lungs. So when we look at the left and right lung, okay, how do we know the left from the right? Well, the right has 3 lobes and the left has 2. So when we look here, we have to make sure we label left and right for lung, and then we have sections. So if I point and I say name the structure, be specific, we've got superior lobe of right lung, middle lobe of right lung, you can see the separations here, and we've got the inferior lobe of the right lung. This little meat hanging down at the bottom is the diaphragm that lines the base of the lung and goes over the abdominal organs. That's the diaphragm. If we go over to the left lung, we only have 2 lobes. We have a superior lobe of left lung. We have an inferior lobe of left lung. And then we also have the diaphragm sticking down here. Now, the other thing on the left lung, we have this little notch here. This is called the cardiac notch. As far as alveoli, alveoli are going to be microscopic structures, and they're going to be shown from the picture. We have the terminal bronchiole, respiratory, that goes into the respiratory bronchioles, that goes into the alveoli from the alveolar duct. And the alveoli look like little grapes, okay? Like a little cluster of grapes would be the alveolar sac. And so that's our structures for respiratory. If you have any questions, let me know. Stay strong. See you next time.